Tract. Come on. Well, it's not going to stay, so we're just going to go quick through this. Ovaries right here. Okay. They're tiny. They're these yellow structures. There's actually a space in between the ovary and these finger-like projections called fimbriae. Doesn't show that here. Your ovaries are tiny. And inside the ovaries, of course, that's where you make your eggs. What hormone gets them to make the eggs? FSH, secreted by the anterior pituitary, and then LH lets the egg loose. You ovulate, and it pops out of the ovary. It has to go across the space, and hopefully those fimbriae, because they've got cilia in them, will suck that egg into the oviduct here. It's called the oviduct. It's also called fallopian tubes.
Is there a preference on what we label it as? Are you okay with? Okay.
I think oviducts is easier. It's the easiest one. If you like fallopian tubes, you can put that. And again, for your lab test, if we do the fill in the blank again, I always go back through, as you saw, and double check and give you credit for, because some of you just spelled stuff wrong by flipping 2 letters. It's not a big deal. Capitalizing 1 letter, not a big deal. When you hear about a tubal pregnancy, that's a pregnancy that is occurring in those oviducts. And of course, that's not going to work. So the oviducts lead into, of course, the uterus. It is better to open this up to see that uterus here. The uterus, everybody talks about, endometriosis, where your endometrial layer will come out of the uterus, and they talk about a tilted uterus. Well, all the uteruses we have are tilted on the side. It's a matter of how bad they are. And you look at the main part of the uterus, there's a space in here. It's not very big. And then this tissue that lines, this is new tissue every month. That's your endometrial layer. That we replace every month, that we shed every month. That's what's going to help form, of course, the placenta for the baby. It's rich in nutrients. We want the egg to implant in that endometrial layer. And then you've got the muscular layer, which is the myometrium. And of course, that myometrial layer will cause cramping and help to expel that endometrial layer every month. And it will also, of course, with the hormone oxytocin, help to deliver the baby. If we go down at the base of the uterus, and your uterus is not very big, and again, it needs to stretch about 3 times its normal size. Inside the female, this is maybe 7 inches long. Well, babies are 21 inches, right, on average. So it's got to stretch 3 times plus its width. And you can see that if that uterus gets bigger, this is your urinary bladder right under it. So it's no wonder people have to go to the bathroom a lot if they are pregnant. There's a narrowed area here right at the base of the uterus. That is your cervix. The cervix has a lot of mucus glands, and it's interesting. It changes its secretions during your month, the monthly changes. What this will do is it will get thicker, okay, when you're not ovulating, and it will get thinner when you are ovulating. It'll be the thinnest it can be when you're ovulating, making it easier for the sperm to get to the ovaries, or get to the oviduct, not the ovaries, the oviducts, through the uterus. And of course, when you get pregnant, it gets so thick it forms a cervical plug. That sometimes, well, when women's water break, that cervical plug comes loose, and then out comes all the amniotic fluid. This is the vagina here, and look at there, we got rugae again. And the vagina is lined, of course, with glands too. It is acidic, has a pH of about 4 to 5-ish. You want it to be acidic because it is close to the anal opening. We'd like it to kill the bacteria that might come out of there. The vagina technically is just the passageway for sperm. And at the base of the vagina, the vaginal orifice or opening, You have two lips. You have the little lips and the big lips. The little lips are the labia minora. The big lips are the labia majora. This is your clitoris or clitoris. This is the remnant of the penis in the female, and it contains erectile tissue. I think that's it. The female system, pretty simple. And we'll talk more about the hormones. And you do have to know the menstrual cycle. And you'll see a menstrual cycle on your lab test. So you want to make sure that you study those notes, and there's a separate PowerPoint on menstrual cycle. That's it for the female.